joining us today as Mayor Demings will have some comments regarding increased numbers at the Orange County Jail and details surrounding that situation. Also, he will have information on strike teams that we are using for business compliance. Mayor Buddy Dyer is here from the City of Orlando to talk about progress within the city. And of course, Dr. Raul Pino from the Florida Department of Health here in Orange County is here as well to share those very important COVID numbers to us as well. We start with Mayor Demings. Mayor?
All right, good afternoon. Welcome back. We have a lot to share with you today. Some of it is news, some good news, some bad news. So let's see. I think I'm going to start with the bad news first today, and then we'll end on good news. Going back to March the 13th, when we first went under a state of emergency, at that time, we had 0 reported cases of COVID-19 here within Orange County. We had 0 deaths reported. But today, I have to report that we now have 162 deaths in Orange County. That's up by about 43, I think it is, since Monday. That means that that's 162 different families who have had to, unfortunately, face the realities of COVID-19. Because of that, I think we have more believers in the science behind the pandemic. Orange County now has over 25,000 positive cases, 25,254 cases. That's an increase of 547 cases from yesterday's numbers. And our numbers have somewhat fluctuated over time. We have tested over 225,000 individuals, and our overall positivity rate, according to the state, is now 11.2%. We continue to want to make testing available to Orange County residents, and we did significant testing this week at Barnett Park, and that will continue until tomorrow. We have asked people to make appointments in advance. Next week, we are going to move to the east side of Orange County with testing, and that will begin on Monday at the Econ Soccer Complex on Yates Road. We will be testing there from 8 a.m. until 1 p.m., and we anticipate testing as many as 750 people daily. For information on that, you can go to ocfl.net/coronavirus. Talk to you a little bit about what we're seeing in the Orange County Jail. You've heard me say this before, that the Orange County Jail is a microcosm of Orange County at large. With law enforcement officers arresting people from the community and taking them to the jail, we knew that it was just a matter of time before we would have cases in our jail. So yesterday, we received 529 new test results for inmates. Of the 500 plus tests that we got that have been taken over a series of days, 33 individuals were positive, and only 1 inmate was symptomatic. So that means that 32 of the individuals were asymptomatic that were in our jail. 4 of the inmates that tested positive have already been released because this is a local jail. You know, the overwhelming majority of individuals who are booked in our jail are only there for short periods of time. They're not there for long periods of time. So we are awaiting the results now of an additional 150 tests. To date, we have conducted over 2,800 tests on inmates. We anticipate completing testing of the entire in-custody population by next week. Keep in mind, today we have a little over 2,100 inmates in our jail. We test all newly arrested inmates, and the testing is voluntary, so an inmate can refuse to be tested. And we asked Chief Quinones to be here today, our corrections chief, and so if you have any specific questions related to what's happening at the jail, Chief Quinones is here. We have an abundance of CDC protocols put in place at our jail that we believe will help us minimize the spread of the virus within our jail itself. I want to give you an update on our strike teams, our compliance teams that have been going out to meet with businesses throughout Orange County. They started yesterday and so far have visited 57 different businesses. The teams found there was a rate of about 88% compliance to the established guidelines. Of the businesses that were not in compliance, it was because they failed to meet one of the following safety protocols: practicing social distancing, following the mandatory facial covering executive order, maintaining checkpoints and floor markings to assist patrons in staying 6 feet apart, the posting of signage reminding patrons and employees to wear masks, social distancing, and to follow safety protocols. Those who were not in compliance were found to not be following the protocols I just laid out. We do have some staff here today if there are specific questions about what they saw. The teams are made up of representatives from Orange County Code Enforcement, the Orange County Fire Marshal's Office, and the Florida Department of Health. The teams are working throughout Orange County, including within the 13 municipalities. And let me just make another appeal on behalf of our One Blood, which is our blood donation entity here within Orange County. They have asked me to remind our community that there is an urgent need for convalescent plasma. Patients who have recovered from COVID-19 are eligible to donate convalescent plasma for others who are infected with the virus. Convalescent plasma donations may be made every 28 days, and given those who are hospitalized, who are critically ill, the plasma in some ways can be life-saving for those individuals. Eligible donors are required to register at oneblood.org for the convalescent plasma donation process. Now, in terms of the good news, the CARES Act funding for individuals and families has a total of 26,800 approved applicants. Roughly $12.5 million has already been processed by the Comptroller's Office for direct payment to residents. We still have applications in process. Depending upon how this turns out for us, I'm optimistic that we may be able to open up the portal for individual and family crisis assistance again in the near future. More to follow. As for CARES Act funding for small businesses, the program has seen 3,319 applications that have been approved. So far, $31 million has been paid to small businesses in our community. Applications are still being taken. That portal is open around the clock, essentially, and they can go to ocfl.net/orangecares for details. And then lastly, we have a weather phenomenon going on as we are preparing for hurricane season. We're in that season now through November. This is just a reminder that we want our citizens to be ready for any of the potential weather phenomena. It has been about a week since we kicked off the sandbag giveaway. So far, we have given away 22,600 sandbags to over 2,200 households. Barnett and Downey Park seem to be the busiest locations where we're giving out the sandbags. As you may recall, if you go to get sandbags, you can also pick up kits of PPE. Each kit includes masks and hand sanitizer, and so far we've given nearly 11,000 masks and 4,500 bottles of hand sanitizer at the sandbag sites. We will continue to do this through Thursday, July the 30th. And so with that, that's the update that I have to offer at this point. I'm going to turn it over to Mayor Buddy Dyer, and then we'll go to Dr. Pino from the Florida Department of Health.
Thank you, Mayor Demings. No doubt that as we times continue to be challenging as we adjust to a world that we live in with this virus. The new normal we live in, we must continue to take time to listen to facts, follow the data, adjust and adapt accordingly. Change is the one constant thing that we have in our lives, and it's up to us to keep making the right changes that are in the best interest of our own health and our neighbors' and families' public health. I've said this before, but I want to say it again because I think it's important that we as a community will get through this virus, but it is each of our civic duty to protect our community from the virus. And we must all do our part to respond to the virus and control the spread. As we continue to fight COVID-19, we must recognize that others in our community have changed their behavior to benefit every other single person in this community. They're being diligent to protect those they know and even people they don't know. So I want to thank our residents who are making the critical changes and taking precautions like wearing face masks and being strict about physical distancing. These are important and selfless acts because they protect others. And most of all, they're easy to do. So all of us should be doing it and can be doing it. Another important thing that we need to do is continue with the testing. The city expanded that opportunity to residents in neighborhoods. Yesterday, we were at Camping World Stadium again and tested more than 250 residents. Next week, we will be at Lake Nona Middle School on Wednesday from 9 to 1. Appointments open tomorrow. Orlando.gov. Thank you, and Dr. Pino.
Good afternoon. As the mayor mentioned, we have 162 individuals that has passed away from this disease, and those numbers will continue to climb as we have the number of people in intensive care unit, about 100, and the mortality rate for those in COVID-19, with COVID-19 intensive care units is quite high. It's about 50%. That is why what the mayor mentioned about the plasma donation is so critical. If we have 25,000 people who have had the disease in our county, and we subtract 100, 200, the number of people who have died, and if we think that 50% of the individuals in our count on how the disease is behaving in our county are between 20 to 40 years old, we have about over 10,000 people who could donate plasma to try to save the life of those who are in intensive care. Why that plasma is so important is because that plasma has the immunity to the virus. So when you give it to someone who is experienced this disease, you're really giving a boost and a chance of fighting and surviving this disease. That's why I encourage everyone who had the virus and is able to donate blood to donate, because you will really, really, truly saving a life. It could really, really make a huge difference. So the number of deaths I'm going to give you first, reverse the order that we normally do things, to give you the total statistics. Of the 162, there 59% are male, 41% are female. The age range is from 22 to 106. The median age is 76. Race, 30% white, 40% black, 1% Hawaiian, 4% Asian, 19% other, and 31 individuals we don't know their race yet. For ethnicity, 30% of those are Hispanics. Now, the strange thing is that with this sad news, we also have some better news. Our positivity rate in the last 14 days, the rolling average, continues to decrease. It is right now at 14.62%. I would like to remind you that the highest we have in the last 14 days was 19.62%. So we are coming down slowly but surely. And we also, the positivity rate for last week was 14.82. For the prior week was 19.34. So we have seen a small gain in that area. Also, the number of hospitalizations have decreased in the last 2 days, as well as the number of visits to the ER for COVID-related symptoms or syndromic surveillance. And that is a good indication, too, that we may be actively reducing our rates. We also, another positive news is that our recovery rate has increased to 75% from the high 60s that we have it a few days ago. With regard to hospitalizations, and these numbers are a little bit out of date. I have better number than this, but I don't have it in front of me, and I don't want to recite from my memory. But it has been a decrease in the number of hospitalizations. The last number that I have here from July 19th was 619 individuals. I believe, and we will send that graph to the press, Ken, when we get the graph today. For some reason, didn't make it to my paperwork. I believe if the high 500s for the number of hospitalizations, and I'm 100% sure that the number of people in ICU beds yesterday at 8 o'clock were 99. The prior number was 113. So we have seen a small gain in those areas. We also, I would like to let you know that we have a significant outbreak that we are following in an assisted living facility, and we have some concerns. What I'm going to give you is what we have, and we are in the process of obtaining more information. So we have an outbreak that has 66 positive residents in a long-term care facility. 22 of those 66 residents are hospitalized. And in the same facility, we have 30 staff members that are positive. The first positive case in that facility was on June 25th. And the facility conducted, with our support, on July 2nd, 2020, a testing of the entire population. We also send nurses for testing of residents on May 24th and in July 13th, because we have been watching this place. And we also, on July 7th, assessment and education teams were sent, as well as inspection control. And then when they tested individuals on the 11th, which we got the results, we got this number of positive people. The facility will be visited by ACA and us tomorrow. I went there today and surveyed the area and watched from the other side. Didn't want to get in because of the high number of cases, and I really can't afford to get in a situation like that right now. We have serious concern about the number of people who are hospitalized, the number of residents. We don't know the total volume of the facility, what is their caseload. The facility is in Ocoee, and we will continue to monitor. We will do the same approach that we have with the other facility, Green Tree, that we had an outbreak. And this is not the only outbreak that we have in long-term care facilities. Remember, outbreaks are defined by 2 cases or more, although in long-term care facilities, to be more aggressive, 1 person is considered to be an outbreak, so that we do the same that we do for many other cases. And we hope that we will have positive outcomes. But of course, we will descend on this with all the resources that we can muster to help this facility. Thank you.
Okay, we'll open it up for questions if there's any Spanish-speaking media that's here. If you want to ask your question in Spanish, we do have the ability to have a translator here. We have Ms. Ilia Torres, Dr. Pino is fluent, and we have Commissioner Gomez-Cordero, who is here also. So, thank you. Questions?
Mayor Lauren Seabrook, Channel 9. My question's for Dr. Pino. As soon as this information about the nursing home goes out, we're going to hear from people that are going to want to know the name of the nursing home facility or assisted living facility.
All the nursing homes, yeah, it's Ocoee Health Center. The nursing home names are not any longer confidential. They are published in the web. All this information is in the web, and every single nursing home in the county and in the state that have even 1 case is listed in the statewide page. Yeah.
Okay, and then additionally, can you also talk about, I noticed up on the monitor, it said, I think 4 days old was the youngest case we had, and I noticed a 22-year-old was the youngest death we had. Could you talk about maybe some of those younger ages and what you think may be leading to these high numbers of deaths?
So the high number of deaths is a reflection of the high number of cases that we have, since 2 weeks ago. And every data in these pandemic lags about 10 days, 10, 12 days, 15 days. And it always we did not adhere to the guidance that we have received and what things should be done. You see an increase of number of cases. You see an increase of number of hospitalizations. ER visits first. You see an increase of hospitalization. You see an increase in ICU, and then you see an increase in the number of deaths. It just works like a clock on how the orderly fashion and lagging time between those different indicators, it just works like that. And this is what we are seeing. We are seeing the results of the high number of hospitalizations that we have due to the high number of cases that we have a couple of weeks ago.
The young death, the 22-year-old.
The 22, yes. I don't have the details, but that's a real.
Steve Hudak from the Sentinel. This is also for Dr. Pino. That outbreak at the long-term care facility, are there any deaths, first of all, associated with that outbreak?
Not from this one that we know.
Okay. And when you say that this is a facility you've been monitoring, how unique is that? Are you monitoring other?
So we monitor, all facilities are monitored in one form or another one. But we have always a short list of facilities that we have some concerns due to infection control practices that we noticed that may not have been up to snuff. It could be the physical conditions of the space. It could be the large census of individuals that they have, or the large number of cases that they have. So it could be a number of factors, but our EPs are very familiar with assisted living facilities in the county, which we have close to 200 in our county. And do we monitor, and we do have places of concerns that we follow closely. This was in our list.
Dr. Pino, Asher Wildman, Spectrum News 13. We've heard week after week from Governor DeSantis about the orders of remdesivir. Today, in fact, he said it was a tool in the toolbox. I'm just curious. He says the physicians like it. Can you speak to if it's working, what it's doing, and perhaps how much we are getting of these orders?
So people who are in clinical practice are better equipped to talk about why they like it. I know they like it. I know there has been positive results, and our physicians here in the system do like it. At some point, the health department was involved in distributing the remdesivir for area 4 and 5, but now it has been centralized at the state level. And we got over probably 2,000 dosage that we gave here in the county. I don't know the numbers right now as it has been distributed at the central office from Tallahassee.
Stephanie Buffmonte with Fox 35 News. For you, Dr. Pino, what's being done to protect those residents at that nursing home who aren't infected?
So there are several steps that are taken. So nursing home has been tested every 2 weeks by the state. And in many facilities, also the facilities themselves have decided to step up and test those individuals. In some cases, they use their own resources. In some cases, they work with us. Either way, residents are getting tested. As you can see, only 22, and when I say only 22, don't take it lightly, 22 is a high number, but about 50% of those cases are symptomatic and have required hospitalization. So normally, depending on the condition of the facilities and the physical space, if they have the ability to, they do isolate these individuals from the rest of the population. That's one step that they take. The other step that we take is that we will go and observe, and that means the state, not the health department itself, but the state health department will go and observe for 12-hour shift the practices to try to identify if the outbreak was due to lack of some infection control practices. And then at the same time, we educate the staffing. We also normally will suggest the facility to hire a staffing company to supplement the people that they may have to put in isolation from the workforce. The state can also help with that and send some nurses or other type of health help for them too. And also what we will do is we will retest the entire population at some point to see what type of control has been executed.
Kelsey Thord with West 2 News. My question is either for Mayor Demings or the head of corrections. Can you talk more about this outbreak at the jail? I know you said there's 33 new cases, but how many cases in total have there been at the jail? And then what are you doing to try and stop the spread of the virus within the jail? Because I know this is a problem not just in Orange County, but across the state.
Okay, well, my name is Luis Quinones, and as the mayor mentioned, the chief of Orange County Corrections. And what we're doing to eliminate or reduce the spread is at the very onset of the pandemic, the management team got together and reviewed the CDC guidelines. They have special instructions for detention facilities. So we went ahead and reviewed that, and we put an action plan into place. I'll give you some of the examples of what we've done. They're not all inclusive. But what we did is we implemented an inmate booking process, and it's a questionnaire. And what happens is when an individual gets arrested, we ask them certain questions. We ask them if they have traveled certain places, whether or not they've tested positive. Then what we do is when they first come in, we put them in what we call a quarantine housing unit, and that's anywhere from 14 to 30 days, so that way it goes through the incubation period before we even put them into general population. We've educated our staff and the inmates, and the way we've done that is we've put signages, just like you see in the community, is exactly what we're doing inside the jail. We're notifying our staff, the inmate populations. We're practicing social distancing when possible. Any individual coming into our facility takes a temperature check. We have enhanced the amount of PPE within the facility. We've given staff the face masks so that they can wear, and that is a mandate. We've also given inmates masks so that they can wear them as well. We've stopped all non-essential visitors from coming into the facility. What we put together is what I call a quality assurance team, and that is to make sure that they go around the facility and they check on all of the preventive measures we've put into place to make sure that everything is up to par. We've began to do contact tracing, and what we want to do is we want to go ahead and try to find out where it's coming from and making sure that anyone that has been exposed, that we isolate that individual. I put out weekly COVID-19 updates to staff, letting them know what's going on in the jail and what we need to do to reduce the spread. We've contacted the Department of Health, thank you to Dr. Pino for his assistance on that, to speak to them about the contact tracing and any other additional measures we can take to reduce the spread. And we have, up to date, 2,800 inmates we have tested. And going back to the last part of June, we started testing every inmate that comes in. Once again, I have to let you know that it is voluntary. They can refuse that. And the good thing about this is that we're taking proactive stances and putting procedures into place. We've got a machine called the aeroclave machine. And what we initially were doing is anytime a housing unit was infected, we would go there and utilize that AeroClean for disinfecting purposes. But now what we're doing is we're putting that aeroclave machine into practice to a preventive maintenance plan. So we're doing that, and that's where we're at. I think you asked the question of how many current inmates, correct? Okay, so in total, as of yesterday, and I will tell you that that number has decreased. So total is 75 inmates have tested positive. We had approximately 44 that are in custody. That number has reduced since yesterday. 16 individuals were released from custody and 15 have recovered. One of the things that I like to focus on is that right now, out of the 40 plus that are in custody, only one is symptomatic, and that individual is in a medical isolation unit and being monitored by our medical staff.
Good afternoon, Curtis McLeod with Spectrum News 13. My question is for Mayor Dyer. Mayor Dyer, I noticed around downtown, a lot of businesses or a couple of businesses have closed up. I'm not sure if it's directly related to the COVID situation, but can you talk a little bit about resources for the businesses that are still closed that the city may have for those business owners? And also tell me a little bit about the city's plan going forward. Are you all concerned about the future of downtown Orlando as these businesses remain closed?
We're concerned about all the businesses in the city of Orlando with the heightened outbreak again. The governor issued an order a couple weeks ago, I guess, closing down all of the bars. So certainly those are an integral part of our downtown. But people aren't frequenting the restaurants as much as they were before. So they're seeing some difficult times as well. So we still have some of the things in place. The Uber Eats program that's free delivery in the downtown, the free parking to come downtown, use of outside space, the public space in the downtown. The business assistance grants or the business care grants are through the county, so they are eligible just as anybody else is for grants downtown. But it's a tough time, and the best thing that we can do for our businesses is do what I've suggested before, is wear your mask, because we got to contain the outbreak of the virus if they're going to successfully operate again.
Text in from Eric Mock with News 13. This is for you, Dr. Pino. The Orange County School Board has, the Orange County School Board has criticized the health department for not taking a more active role in advising them. How do you respond to this criticism? And for both you and Mayor Demings, do you think the county is ready to send children back to school? So
the criticism, I think it comes from lack of understanding of what the role of the health department is. We do not open or close school systems. That's the decision of the board that is an elected body that have to have the best interests of the community at heart, the same that we do, and they do. Our role in this process has been to advise them on best practices as developed by the CDC and others that could openly save the schools. That was the charge for us from our offices. And also to provide the school board with a clear indication of what the data is showing, what are the trends, full transparency, so that they can make an informed decision to open or closing the schools. I have no issue making a determination if I have the authority to do so. What I'm trying to avoid by not making any comments is that any decision that we make should stand and not to be reversed by someone else that may have more authority than us, because then the health department would lose any credibility with our community if we make such a decision and someone else can change it. Into that, I have requested for further clarification from the state in what our role can be and what the interpretation of the emergency order by the Department of Education may contain for us. So legally, there are some challenges there that they are analyzing. If their directive to me change, my position will change.
Thank you. And I guess, Mayor Demings, this was for you. Do you think the county is ready to send its children back to school?
Let me preface it first by saying this. The governor made a directive through the Commissioner of Education that essentially took away the ability of local governments, local counties, to make the determination about whether the schools would reopen. The directive says the schools shall open in August. So it's not a decision point that I have at this point. I will say I've had multiple conversations with the superintendent and others within the school district. I've had conversations with Dr. Pino, and the district has been entrusted with the responsibility to make some decisions within the constraints of what the executive order says. Are the schools safe to reopen? The short answer is, I don't know. But I believe that the decision about whether to return students to school or not is something that the parents are going to have to take under serious advisement from the school district and make a determination, because there are options where if a parent does not believe, based upon all of the information and the data that the district is providing them, if a parent doesn't believe that it's safe to send their child back, they shouldn't send their child back. And there are some options, with distance of virtual learning that could come into play in that decision making. And so I would encourage the parents to make the right choice for their child. And that's the best that I can tell you at this point. I do have grandchildren in the public schools and the elementary school. And so it's concerning to me about where we are today, how the scheme of keeping the students apart and safe and providing for the education can be done. But I'm not the expert in that regard, so we'll see where this takes us. Now, I'm aware also that our school district has put in writing some correspondence to the governor asking for some and asking for the ability to make some modifications, asking him to modify his order to allow the district to make some decisions that's unique to our district.
Lastly, this comes in from Ryan Lynch with the Orlando Business Journal for you, Mayor Demings, in regards to the strike teams. For the strike teams, what kind of businesses were visited in the first couple of days, and what kind of goals does the strike teams have in terms of the number of businesses they will look to visit in a week?
So I touched on it a little bit earlier, but let's see, who's here from, okay. Tim Boland will come forward and kind of share with you what they saw. He's been briefed by his staff. Okay.
Thank you, Mayor. Part of the goals is we're trying to educate the businesses out there and the retail establishments and in compliance with the executive orders that are out there. The strike teams have been out there for the last day and a half. They're finding a receptive audience. These business owners really want to make sure that that they're able to continue to be open, and so they're doing what they can to comply. The few that haven't, that were not in compliance, the majority are with the posting of the signage of the mask wearing and so forth. It's so there's a lot of compliance that's happening out there, and they continue to want to comply. So we're having good results so far.
WKMG News 6. I have one question for Dr. Pino. And Dr. Pino, I know you touched on this. I was listening to your answer, but I wanted a clarification. Corcoran's emergency order says that school openings must be consistent with safety precautions as defined by the Florida Department of Health. So who has the authority then to open or close, keep schools closed?
So the interesting thing about the order is that we are not. I work for the Florida Department of Health, but are not the Florida Department of Health. The Florida Department of Health is in Tallahassee and is headed by the State Surgeon General. So there are little things in the order that common people on the street will not know. Like Florida public health system, different than most states, is a centralized system. So all the county health departments around the state, the 67, are just an extension of the state health department. They are not independent departments. So I am an employee of the State Health Department who is assigned in Orange County to work for Orange County and the Orange County government in facilitating those processes. But reality, the State Health Department and the head of the State Health Department is the State Surgeon General, not me.
All right, that looks like we have no further questions. I didn't see any Spanish-speaking media, but let me just double-check. If there are no questions in Spanish, then we will conclude the press conference at this time. Thank you all for coming and participating.